In 1974, the Lehigh Valley was privileged to receive funding for an additional hospital site that provided specialized health care for the community. Who was the man behind this, and what inspired him to use a large amount of his finances for this endeavor? Leonard Parker Poole was the man who built an international corporation from almost nothing. Leonard was born in Minneapolis, Minnesota on November 5, 1906. He was one of 7 children. When he was a young boy, he was absolutely fascinated with medicine. Who could blame him? He grew up around it. He sadly watched his sister Hazel die from influenza. He also witnessed his father's mini-strokes from high blood pressure. Unfortunately, his family's financial situation prevented him from receiving advanced education in medicine. Once quoted by Ed Donnelly, a close friend of Poole's, because of his lack of education, Poole had an almost over respect for education. If a man had a PhD or was a professor, Leonard respected him. Being the kind person that he was, Leonard did not want his brother to share the same fate as him. So he never finished high school and helped his brother pay for medical school by working additional jobs. Because Leonard's father died when he was only 20 years old, his mother relied heavily on his income to help support the family. He had many careers that shaped him into a good businessman and enhanced his interest in technology. This eventually brought the expansion of the oxygen and chemicals industry. In 1937, he became the manager of Railroad Sales Compressed Insulated Gases Incorporation in Chicago, a job that impacted him greatly and increased his interest in chemicals and gases. He later became the general manager of the railroad company in Detroit from 1937 to 1940. Because of these experiences and his perseverance, he eventually founded his own company called Air Products and Chemicals Incorporation. He was the chief executive officer and director of Air Products and Chemicals in Allentown, Pennsylvania from 1940 to 1973. In addition to his career, he became chairman of the board of Allentown Hospital and Sacred Heart Hospital from 1973 to 1975. Still having a desire to be involved in medicine, he became a trustee at both hospitals. Finally, he was named president of the board of directors for both Allentown and Sacred Heart Hospital Centers. How and when Leonard met his wife, Dorothy Ryder, is largely unknown. They married in 1931. The expansion of his company, Air Products, brought them to the Lehigh Valley. He and Dorothy moved to Emmaus together in 1946. As told in stories, they were a delightful couple and complemented each other well. They had a fabulous 35 years of marriage together. Dorothy was highly intelligent and enjoyed painting and playing the piano. Unquestionably, one of her greatest accomplishments was knowing and understanding the complicated Leonard Poole better than anyone else. They had no children. Despite many of her good qualities, Dorothy was a heavy cigarette smoker. As everyone knows, no good thing can last forever. In 1966, Dorothy Ryder Poole was diagnosed with advanced lung cancer. Due to the lack of specialized health care locally, her Allentown physician sent her to Sloan Kettering in New York. While she was there, she was found to have complications from her cancer that included severely unbalanced electrolytes that caused significant weakness. Dorothy was treated by many doctors, but no doctor could cure her completely. Fortunately, she got to live a couple more months than she was predicted to have. In 1967, Dorothy died at Sloan Kettering. After Dorothy died, Leonard had a vision to bring that same specialized health care to the Lehigh Valley. Leonard once had a vision that was about to come to life. Allentown and Sacred Heart Hospital centers were planning to merge to create one super hospital. But unfortunately, the merger did not go the way that it was planned. Leonard donated more than $5 million to get the merger back on track again. It was years in the making, but out of Mr. Poole's kindness, generosity, and financial contribution, eventually, the Lehigh Valley Hospital was born. Originally, construction started in 1967. The new hospital officially opened its doors on September 16, 1974. In addition, Mr. Poole also created a trust in Dorothy's name. This trust was to last for 50 years. He could have left his money directly to the hospital, but he chose a trust because he wanted to continue to have money available to ensure the success of the new hospital. The trust will terminate its existence in 2025. Mr. Poole also left money to the Ryder Poole Foundation that he and Dorothy created together in 1957. This money primarily goes to improving the quality of life in the community. Several programs have been started, including the Collective Impact Fellowship Program. Even though it has been years since Leonard Poole passed away, his legacy still continues. As Dr. Lawrence Levitt, another close friend of Poole's, once stated in his book, a large portrait of Leonard Poole hangs in the front lobby of our hospital. I often ask him silently, "How am I doing?" Sometimes I have the feeling that he's pleased. He'd be happy. I know that the citizens of Allentown and surrounding communities now have access to a fine academic hospital with the state's first hospice, a cutting-edge trauma center, a burn center, and a cardiovascular disease prevention program that has become a national model. Today, Lehigh Valley Hospital has more than 18,000 employees, making it the biggest employer in the Lehigh Valley. It is also the largest hospital in the Lehigh Valley. More than 50,000 patients are admitted to it every year. Lehigh Valley Hospital has also been mentioned as one of the top 50 best hospitals in America. It is a level 1 trauma center and now provides specialized care in numerous specialties, including neurosurgery, cardiovascular health program, organ transplantation surgeries, interventional radiology, and many others. None of this would have been possible without Leonard Poole. This shows that triumph can come from a tragedy.